you yourself have found that even, making some dietary and lifestyle changes can have a huge impact. And I would encourage everyone to do that. But for some people with very, very significant symptoms, it just feels impossible at that time of their month, and they may need, further medical intervention. And what works for one, as we said, won't work for another. But there are the psychoactive medications, as we discussed, the hormonal medications. Different things will work for different people. We want to ideally avoid having to go down the route of chemical menopause, where you switch off the ovaries, or surgical menopause. Sometimes, though, that is necessary, and sometimes it's life-saving. So I don't want people to think that, and then that they shouldn't do that if that's right for them, but they need to be under the care of someone who understands that and guides them through it. Also understanding removing the ovaries doesn't change the hormone sensitive brain. You still have that brain that's very sensitive, but it just gives it a break because you take away the driver for the menstrual cycle there. Psychological therapies, there is evidence that CBT and DBT can be helpful. But again, you need working with somebody, a therapist who has understanding of the nuances and the hormonal fluctuations. And it's not quite as simple as just reframing, having positive thinking. This is not what this is about. It's about learning strategies to help manage crises. But also, if you can learn to manage very difficult emotions or have some tools, that again turns down that dial, that stress response, which helps calm down that, the body and mind in PMDD. EMDR therapy for history of trauma can be helpful.